Do you guys need a white balance or you got it from the mic? Okay, so good afternoon and thanks for joining us today. My name is Leticia Gomez. I'm the Director of Communications and Public Affairs for the County of Santa Clara. We are at the Emergency Operations Center where we activated the EOC in response to COVID-19. We have a press conference by Dr. Sarah Cody. She is the county's health officer and she has some words for us. She's not going to take one-on-one questions at the end. She will not. If you need interviews in Spanish after she's done, you can talk to me. Dr. Cody.
Thank you. Thank you. Good afternoon and thank you for coming. Again, my name is Dr. Sarah Cody and I'm the Public Health Officer for the County of Santa Clara. So thank you for being here today and helping us to share our public health message as we take additional actions to ensure that we're preventing the spread of COVID-19 and in particular reducing the risk to vulnerable individuals. I'd like to start by giving some thank yous to our entire team across many county departments who are here providing support to our public health department, the team from the Centers for Disease Control and Prevention who are on site working in close partnership with us, and the many other local officials from cities, school districts, and the community who've offered their assistance to our department. Today, I'm here to provide two important announcements. First, we've identified 2 new cases of COVID-19 in our county, which brings our total number of confirmed cases to 11. The source of infection for these 2 individuals is still under investigation. And second, today we're providing new local guidance for our county regarding how individuals who may be at higher risk for severe infection can reduce their likelihood of exposure. So I'd like to just walk you through this guidance, and after I do, I'll provide a few reminders about the many other recommendations and guidances that have been issued by the CDC and other public health officials. So first, who is at higher risk of severe disease if infected? As you may know, information about what increases the risk of severe illness is still evolving, as is much information about this new infection. But the best current evidence available makes clear that the risk of severe illness increases with age. The risk begins to increase after about age 50 and accelerates with increasing age. So for example, a 60-year-old is at greater risk of severe illness as compared with a 50-year-old, and an 80-year-old is at much greater risk than a 60-year-old. People at greatest risk of severe illness are persons aged 80 and over. Also at increased risk for severe disease are persons with underlying medical conditions, including persons with cardiovascular disease, diabetes, cancer, heart disease, or chronic lung disease, as well as those who are immunocompromised. So what should people do if they are at higher risk? We're recommending that people at higher risk avoid mass gatherings such as parades, sporting events, and concerts where large numbers of people are within arm's length of one another. So this would not include typical office environments or grocery stores or shopping centers where it's unusual for large numbers of people to be within arm's length of one another. So in general, I want to just tell you that this is not exact and the risk occurs along a spectrum. So the risk increases with age, with the amount of time and close contact, with the number of people who are together, and with how close people are to one another. We're recommending that organizations that primarily serve seniors or medically vulnerable individuals cancel mass gatherings. So for example, a large bingo gathering or a movie screening. We also recommend that they are extra vigilant in following recommendations regarding cleaning of high-touch surfaces. So this would include countertops, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, etc. We're also recommending that organizations take all necessary measures to ensure that employees, visitors, and persons and members served who are experiencing any symptoms of illness stay home and avoid contact with others. And finally, we're recommending enhanced screening of visitor staff and residents for symptoms who may be visiting groups at higher risk. So again, I want to emphasize that this is an evolving situation, and therefore these recommendations may change. And we may recommend that individuals and organizations, we want to ensure that individuals and organizations watch for new guidance and follow new guidance as it's issued. We also ask that all members of the public continue to be vigilant about hand washing and staying home when sick. And before I close, I just want to remind everyone that the CDC continues to work closely with us in our county and has released a number of new guidances. There is currently guidance for schools, for persons planning or hosting mass gatherings and large community events, for persons returning from countries where COVID-19 is widely circulating, and for businesses. And I'm happy to take a few questions. Thanks.
As of yesterday, we were talking to school systems about their plan. They could not give us a definitive answer if schools should be closed if there was a confirmed case. They referred us to your office, and ultimately the answer yesterday was those policies were still being developed. Why was that the case so long after we had our first confirmed case? Why weren't those plans already gamed out long before yesterday was done?
So there is currently guidance for schools. At this point, where schools are looking at their plans and thinking about what they need to do what they could do within their physical facility to help students with increasing hand washing, to think about how to improve social distancing or keeping students at larger distance from each other, and also thinking about what plans they need to put in place should a school be closed. The decision to make changes to after-school activities are also decisions that schools can make on their own, and the school districts in our county are working closely with the County Office of Education, and we are working closely with the County Office of Education as well to ensure that information and guidance gets out to schools.
But I guess my question specifically is 1 month or more than a month after the first confirmed case in the county, why weren't there clear guidelines and guidance to schools before today about what they should do if they get confirmed?
Right. I want to go back and emphasize that this is a brand new infection that the entire world has only been dealing with for a few months. This is unprecedented, so there's never been guidance that's been written for schools around COVID-19. I also want to say that the decision to close a school is a very serious decision with enormous impacts on the community, not just the students and their learning, but their families and the entire community. So it's very important that we think extremely carefully about what the triggers are to recommend closure of a school.
For these 2 new cases, how is it that you all found out about it? Did they go to the hospital, and were they in contact with anybody else in the county?
For each new case, the process is as follows. If a provider is caring for someone and they think that they are at increased risk of COVID-19, their provider contacts us at the health department. We help facilitate collection of specimens and test them in our laboratory and then report the result. These are newly reported cases. We've just begun the investigation, and unfortunately, I don't have much further detail about those 2 cases.
When were they first reported, and are they county residents?
They are county residents, and they were reported today.
Male, female, adult?
I actually don't even have those details. I apologize.
In talking to some people with local governments and school systems, there has been frustration expressed privately at what they describe as a lack of communication and coordination with them. I wanted to give you an opportunity to respond to those feelings as well.
That you're specifically referring to?
Local governments have said it's been difficult to reach you guys, it's been difficult to get information, they've just expressed frustration with what they perceive as a lack of communication and coordination.
So as you can imagine, this is a very complex event. There are many different sectors with whom we need to receive information, develop information, and share information. Those would include schools, businesses, local governments, hospitals, other healthcare facilities, providers, the public, et cetera, et cetera. We are doing our very best to ramp up as quickly as possible, and I think that with the activation of the county's Emergency Operations Center, we're getting better at this every day. And we are absolutely doing our very best. That I can assure you.
Our county executive, Dr. Jeff Smith, will address that question as well.
We just had a electeds countywide conference call yesterday, and we're going to continue to have those. We have a email blast where they can have access to us directly. We've established the EOC, which is accessible, and we've given everybody on the electeds email group list a contact with, which is Brian Darrow, one of my assistants. And just for completeness sake, I'll say his email is brian.darrow, D-A-R-R-O-W, at ceo.sccgov.org. We're quite well aware that there are a lot of people who want to know a lot of information, and frankly, a lot of information that's not really available yet because we're still researching on a nationwide basis what the risk of this virus is. And so we're trying to communicate basically a measured approach. We want people to be significantly concerned. We want them to know that we're concerned, the state and the federal experts are concerned. They're doing all they can to develop a better understanding of the virus, but it is a brand new virus. But we also want to communicate to the public and elected officials and any leaders in the community that now is not the time to panic, nor is the time to shoot from the hip. We have to have measured responses that are based on facts, and those facts and figures come from the feds and the state, and we're trying to stay consistent with those. So I realize that people have been complaining. I would just encourage them to contact us, and I've just given you the ways that they can contact us.
Question for Dr. Smith or Dr. Cody?
Quick question. We had seen at the Good Samaritan Hospital some tents go outside. Is that to increase bed space, increase space for testing potential patients?
All of the hospitals in the county, and for that matter, other health facilities, are preparing their own continuity of operations plans. I can't speak directly to Good Samaritan, but you will see if you go around to the county that each hospital has its own plan of how it will deal with the potential risks, and everybody's trying to get ahead of the game so that when further information comes out, they can respond. We know just from the nature of infections that there will be more infected individuals, and there are more individuals out in the community now who have been exposed and will eventually have a positive test. Part of the problem with understanding this virus is the fact that we don't really have accurate numbers from China and from around the world about the number of people who have either asymptomatic infections or minimally symptomatic infections. So that skews the fear ratio, because all we get reported about is bad outcomes. We don't get reports about people who got the virus and then cured themselves.
Dr. Smith, what happens if somebody thinks they may have contracted the virus and they can't afford the test to get tested? I mean, what happens when people can't afford to go see a doctor?
Do you want to give that answer?
All of the testing for this new virus is done in our public health laboratory, so it's not an issue of cost. Anyone who needs to be tested is tested.
So, like, it doesn't cost anything to go see a doctor and say, hey, I might have the virus?
Well, it's part of their health. It's part of their health. It's part of their healthcare visit. That test itself. There's not a. That's part of our role in public health to provide the testing and the test results.
What if they can't afford the healthcare visit? Like they can't
I think that's a whole other question. But we certainly don't want to have any barriers for people who are ill to come in and get care and get tested if they need it.
You were talking about those folks that are a little bit older. Is it a risk for them to actually go visit any hospital for that means, since they are in a bit of more risk? Should they call a doctor, go over to their house, or what should be the path for them?
So I do want to emphasize that the risk increases with age, and it does begin to sort of pick up steam. So a person who is 70 is at quite a bit more risk than someone who is 60, and someone who is 80 is at much greater risk than someone who is 80. I'm not sure if I said that clearly. Anyway, the risk increases with age. So places where people at increased risk shouldn't go. It's large gatherings. It's places where people are going to be in close contact to each other, and it's places I think that we don't have any specific recommendations around healthcare facilities, but if there's not a need to go, in general, people at increased risk, as much as they can stay in small groups, the better.
All right. That's it. Thank you.